Hi guys, welcome to our another lecture. Today we're going to talk about the anatomy of the ear. Right, so let's get into it. So we're going to talk about the ear, the orientation, the structures that are found in your ear. Right, we know the ear is a special organ for hearing and maintaining balance. Um, so you're going to discover that the ear is going to be divided into three. You're going to have your external ear, your external ear, your middle ear, and your internal ear. Right. So the external ear, it actually has what we call an auricle or a pinna right here. This flap like um this flap like fold that is responsible for catching vibrations, right, and channeling the vibration into a canal called your external acoustic um, meatus, right? And then you're going to have your middle ear, right? That's going to be separated from the external ear by a membrane, which is called the eardrum, or simply called the tympanic membrane, right here. So from the middle ear, then you're going to have your internal ear, right? The internal ear, that's where you have your sensory, where you're going to have your vibrations that are going to be changed from vibrations, sound vibrations into electrical impulses, and then they are transported to the brain, um, where sound is going to be recognized. Is it right? So let's get into it. Let's talk about the external ear. So the external ear, there's two things that are important. You have a pinna or an auricle, and then you have what you call an external acoustic meatus. Right. So let's take a look at the auricle, the structures that make an auricle. But what is very important that you just need to understand primarily is that the auricle has elastic cartilage. Elastic cartilage, not hyaline cartilage, not fibro cartilage. It's elastic cartilage. So that's something that you actually have to know. Right. Right. So this is your pinna. This is your auricle. Right. It actually have folds, right? What is important is to understand that you have a portion called a lobule. A lobule. That's the only portion of the pinna that has no cartilage. So all of this is cartilage, but this lobule has no cartilage, right? So you're going to have this fold. This is what you call your helix. This is what you call the anti-helix, and then you have this triangular elevation, which you call the tragus, and this is your antitragus, right? And then here, this is the opening of your external acoustic meatus. Right, so that's what is important about the external ear pinna. Mainly, it is important for catching vibrations, sound vibration, and directing the sound right inside your external acoustic meatus. Done. It's also important to appreciate that the external ear, the pinna, is going to have various cutaneous innervation, right? So from this diagram, it is going to be innervated by the following nerves, right? So this portion right here is going to be innervated by your lesser occipital nerve. So you remember your lesser occipital nerve, which is a branch of your cervical plexus, right? Your lesser occipital nerve, it will have roots seat coming from anterior rami of C2 and some contribution from C3 in other individuals. These C2 and C3, these are ventral rami that will actually supply your posterior superior aspect of the scalp and a portion of your ear right here, your pinna, right? And then you're also going to have cutaneous innervation coming from your greater auricular nerve. Remember, the greater auricular nerve is the largest ascending branch of the cervical plexus that will be carrying anterior rami of C2 and C3. And it's a very important nerve. If you remember when we did the skin of the face, and we said the skin of the face around the angle of the mandible is going to be supplied cutaneously by the greater auricular nerve. So this is the greater auricular nerve. It also supplies the skin around the mandible and also supplies the skin of your pinna, right? And then this portion right here, that is the most anterior portion of the pinna, is going to be innervated cutaneously by the auriculotemporal nerve, Right. So I think if you get into one of our courses, when we did the course of the mandibular nerve, which is cranial nerve V3, we spoke of a branch called the auricular temporal nerve. So the auricular temporal nerve is a branch coming from the posterior division of your mandibular nerve, and that is going to supply, remember, is going to carry parasympathetic innervation, right, which will supply the parotid gland, and as well as supply your what? Your pinna cutaneously, like here. You understand? Then another important um, cutaneous innervation of the external pinna is that you see these like these blue dots right here. So you're actually going to have your facial nerve giving a branch which is called um, uh, uh, an auricular branch, right? So this auricular branch, yeah, it's mainly called the posterior auricular branch, is actually going to carry some cutaneous innervation to your pinna. So this is the one that is represented by these blue dots, right? And then you also have your another branch that will be coming from your vagus nerve, also supplying cutaneous, also bringing cutaneous innervation to the ear. So just a summary, um, cutaneous innervation of the pinna. One, the lesser occipital nerve coming from ventral rami of C2 and receives some contribution from C3. Two, the greater auricular nerve coming from ventral rami of C2 and C3, which is the largest branch, ascending branch of your cervical plexus. Three, you're going to have your auricular temporal nerve, which is a branch from the posterior division of your mandibular nerve, right? That will give cutaneous innervation also to the anterior aspect of the pinna. And then right inside your pinna, you're actually going to have some contribution coming from the facial nerve, which is your cranial nerve number 7, and your vagus nerve, which is your cranial nerve number 10. Now, let's take a look at the blood supply to the external ear. Right, so this is a beautiful diagram that can actually summarize the blood supply to the ear. So it's actually very easy if you understand the branches that are coming from your external carotid artery. So because these are the branches that are going to supply the auricle, right? So you're going to have, if you remember, we say that you're going to have your external carotid artery that is going to bifurcate or terminate right inside your parotid substance into giving a larger maxillary artery and a smaller superficial artery, which we said you can actually feel the pulsation of the superior temporal artery right anterior to your auricle. So definitely your superior temporal artery is actually going to send blood supply to the auricle. Easy. And then we also say that the external carotid artery is going to give posterior branches or posterior division. And one of the posterior divisions is going to be your posterior auricular artery. So the posterior auricular artery which will give an auricular branch that will supply your pinna. So that's the blood supply. And the veins, they correspond to the artery, straight and done. Right. So let's take a look at the lymph drainage of your ear. Right. So blood supply, we did the blood supply. Now we are now doing the lymph drainage of the external ear. Right? Good. So your external ear is going to drain in the following lymph nodes. So we are going to divide the ear into two. You're going to have your anterior and then your posterior external ear. So you're going to have your anterior and your anterior portion, and then your posterior portion of your external ear. So the anterior portion of your external ear will actually drain into the your para, your parotid lymph nodes. So when you're going to do the structure of the lymph nodes, you're actually going to have your parotid lymph nodes. So these are your parotid lymph nodes. So the anterior portion of the external ear drains in the your parotid lymph nodes. And then the posterior portion of your external ear is actually going to drain into two lymph nodes, one being your mastoid lymph nodes right here, and your superficial cervical lymph nodes. So summary, anterior portion of the ear, parotid lymph nodes. Posterior portion of the ear, of the external ear, you're going to have your mastoid lymph nodes and the superficial cervical lymph nodes. So that's everything that you actually have to understand um, about your auricle. Let's take a look at the external acoustic meatus. Right, so let's take a look now at the external acoustic meatus. The external acoustic meatus is about 2.5 centimeters long, and it is not straight, right? You're going to have it is a bit oblique, that if you are going to look for the tympanic membrane, right, in a normal patient, in a normal patient, you're not actually going to see the tympanic membrane because the canal is oblique, it's not straight. So this canal is going to be divided into thirds. You're going to have your lateral one third, which is called an elastic cartilaginous third, which is made by elastic cartilage. And then you're going to have your bony, your bony portion, which is your medial two thirds. So right here, this is your medial two third. Right here, this is your lateral one third. So your lateral one third, it is made of cartilage. You can see the 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 rims of elastic cartilage, and within the lateral third, the skin of the lateral third is going to be having numerous sweat glands, numerous sebaceous glands, hair follicles, and special glands of the ear that are called your ceruminous glands, which are modified apocrine glands, right? Which is very important, right? So, what is important is the lateral third is elastic, right? And then the medial two third is the body, right? So in a uh, in a in a process called otoscopy, let's say you want to view the tympanic membrane. Remember the tympanic membrane, the one that separates the external ear from the internal ear, right? If you want to see the tympanic membrane, what do? Right? In if the patient is an adult, NB, right? The pinna or the auricle, right? Backward and superiorly, backward and superiorly. So when you put backward and then you put superiorly, right, you're going to find that the external acoustic meatus is going to be straight, and you'll be able to see what you call the tympanic membrane. That is for adult. This is a process called otoscopy. And then if you want to see the tympanic membrane in children, right, in babies, you have to understand that in babies, the tympanic membrane is actually closer to the external surface of your skull. So for you to see the tympanic membrane in children, you pull the pinna backward and downward. So in adult, it's backward and superiorly. In children, it's backward and downward. That is what we call otoscopy. Otoscopy, when you are looking for the tympanic membrane, right? So that is what is important. Let's take a look at the tympanic plate, tympanic uh, membrane. That is your eardrum, right? So your tympanic membrane, it is this uh, um, um, okay, it is a membrane that separates the external ear from the internal ear, right? And then if you are to look at it, it's going to look like this one, right? So you're actually going to have the tympanic membrane being attached to the end of the malleus, right? So you can actually see a fold, which is called a malleolar fold, which is for the hand of the malleus, right? And then about 5/6 of the tympanic membrane is made by what you call the pars tensor. The pars tensor, right? The pars tensor um, is gonna make 5/6 of your tympanic membrane, and then you're going to have a portion called the pars flaccida, right? So NB, the tympanic membrane from histology, you're going to find that it's going to come from embryology. It's going to come from three germ layers. That's your ectoderm, mesoderm, and endoderm, right? So, but histologically, you're going to have your external portion of your tympanic membrane, or the most lateral portion of the tympanic membrane is going to be lined by skin. So it's going to be just stratified, keratinized squamous epithelia. And then the middle portion of the tympanic membrane is actually going to have fibroelastic. It's fibroelastic. And then the inner portion, that is the one that is the lateral wall of the of your middle ear, as you're going to see. It's going to be lined by simple cuboidal or simple squamous epithelia. Right. So at the area that is called the pars placida, NB, there is no middle layer. So you actually have uh, a, the fusion of your ectoderm, right? A portion derived from the ectoderm and a portion derived from the endoderm. You don't have the middle layer, the middle fibrocartilaginous layer. Just the same as if you remember from embryology, we have your your cloacal membrane and your oropharyngeal membrane. Would you say that there is no mesoderm between the those layers? There's actually complete fusion of the extent of the ectoderm and the endoderm. So that's the same thing that happens on the pars placida. Right. So what can go wrong? What can go wrong? What can go wrong in the external ear? Let's take a look at what can go wrong. Right. So this one is your pars tensa, which is 5/6. This one is your pars placida, right? Which we say is a layer where there is no fibroelastic cartilage. Right. Good. So let's take a look at some clinical correlates regarding your external ear. So the first one is otoscopy, which we already explained that if you want to see the tympanic membrane in adult, you put the auricle backward and superiorly, and then in young children, you put it backward and inferiorly. So that's how you can actually see, right? So here, this number one is called the cone of light. That's where most of your light during otoscopy is reflected. So just called cone of light, which is actually very important. Right. And then lastly, you can actually have what you call acute otitis externa, right? Where you are going to have inflammation, right, happening in your external acoustic meatus. This mainly occurs in swimmers. Remember, swimmers, if they don't dry completely dry the the, the the fluid that will be in the external acoustic meatus, that can actually lead to infection, right? Which can actually cause inflammation, which is called acute otitis externa. So that's everything that I have for you today on the external ear, right? So see you next time. Take care.